Now it's time to bring on Julia Koehler, who is an MD, pediatric infectious disease specialist and assistant professor of pediatrics at Harvard Medical School Association, and Regina Larocque, an infectious disease physician and researcher at Mass General Hospital and associate professor of medicine at Harvard Medical School. Both will help us to understand more about the new COVID variants and what all this means to us. Remember, our goal is not to sow fear, but to equip us with knowledge that can inform our decision-making. So welcome, Regina and Julia. Thank you for being with us here tonight.
Thank you so much for having us. It is really a pleasure to be with you, Mary and Beth, and I really appreciated hearing Alan's very detailed review of the data in Massachusetts. It's really a topic we touched on at the last forum, which are some of the real limitations of our data gathering in public health and infectious diseases in the state and nationally. We have some real limitations. So Julia and I just wanted to touch on emerging science over the last 2 weeks, really, that has added some extra urgency to the concerns about community transmission that Alan was raising in his presentation. So I think everybody who's following the news is aware of the emergence of a few variants in the COVID, the virus that causes COVID. And frankly, these are a change in the dynamic of the virus that really is important and is something we all should be thinking about as we look to the mitigation strategies and the vaccination programs that are rolling out. So I just wanted to briefly touch on what it is that is happening to make sure everybody understands that. So the coronavirus is a type of virus that is a very sloppy virus when it replicates. Any virus has as its purpose to infect a human cell or another animal cell and replicate, make copies of itself. And what we've seen now in the setting that we're all faced, where there is so much viral replication going on, so many people who are infected, that we have seen by chance, probably, the emergence of a couple of different variants in the virus where the genetic code of the virus has changed. And it's changed in a way that offers the virus some advantages. This is evolution in action. So these viruses that have emerged, and they've emerged in a couple of different places around the world, have proven themselves to be very concerning because of a couple of different reasons. The first being that we have clearly seen epidemiologic evidence that these variants are much more transmissible than the variants that had been circulating before. So when they emerge in a population, they quickly take over, and they therefore can kind of overwhelm the system quickly. There also has now been a couple of different lines of evidence that show that these variants also are not quite as amenable to the activity of the immune response that is generated by some of the current vaccines. So it doesn't mean that the vaccines don't work against these variants. It just means that they don't work quite as well as they against some of the other ones. They're still very important tools in our toolkits, the vaccines are, and we need them. So the point to this being that the story of the pandemic has been that new information emerges over time, and we need to be nimble, and we need to respond to that information when it occurs. And what we've seen here is that, really because of our failure to get this under control before, we're now facing such high rates of transmission that the virus continues to get an upper hand on us. And so now is the time when we need to be doubling down on all of the efforts that we've been working on for so long with masking and distancing and ventilation and testing, and now vaccination as well. These are all things we need to be doing at maximal amounts. And we need to be paying really close attention to what the virus is doing in response. So I think that the point being, this underscores the importance of what you're going to hear about with testing as another tool in our toolkit for keeping things under control.
Mm-hmm.
Julia, do you want to add anything to that?
I just want to highlight among the great points you made, Regina, that these viruses, the most concerning variants, because variants arise all the time, have arisen in 3 parts of the world where there has been out of control viral replication, and that is South Africa, the United Kingdom, and Brazil. The reason is that the more opportunities the virus has to make multiple copies of itself, the more opportunities it has to try out which ones can infect the next person most efficiently. The more it has that chance for trial and error, like a trillion-fold, the more efficiently those more transmissible and also less immune controlled variants are going to emerge. This country does not have the surveillance to detect those variants at this point. Of some of those variants that were imported from Brazil, South Africa, and the United Kingdom in this country have been found, but it is likely that we have also bred some of them right here in this country because we do have that uncontrolled viral replication. So the reason this is important in this context is several-fold, and I want to just highlight one, which is that the efforts of the teachers to block viral transmission in schools is important, not just for the children and their families, and for the teachers and school staff, educators, janitors, bus drivers, and their families. It is also important for the community at large because the more we have uncontrolled viral transmission, and in some locales, schools actually have been vectors and incubators of uncontrolled viral transmission, the more we have that, the more we are going to give the virus opportunities to, with its trial and error methodology, generate versions of itself that can infect us better, that can escape our immune system more efficiently. In other words, whether we've been infected previously or whether we've been immunized, it will escape. And thirdly, in some cases, to cause more severe disease. So I would say the work of the teachers here and in, throughout the previous months in the state has been hugely important for all the communities in our state because we do need to block viral transmission by every means at our disposal. And as Regina mentioned, we've been talking about the fact we need to get to zero COVID. That is the way that we will not have more escape variants, more transmissible variants arising. And that's a subject for another day.
Right. I like to say, Ellen Johnson Sirleaf, I believe, said it best, that no one is safe from COVID until everyone is safe from COVID.
Exactly.
That's right. That's right. That's right. And, Michael Sullivan is asking if we can advocate to get a vaccine program like New York. Beth, I'm going to give a preview of our really exciting news. The public sector unions, the firefighters of Massachusetts, the Massachusetts Teachers Association, the AFT are teaming up. We've come up with a plan with a medical distribution company to actually set up vaccination sites in one school building in every school district so we can start vaccinating educators. We want to launch a pilot in 20 municipalities so that we can see how it goes. The firefighters and the EMTs are trained to vaccinate. And what we really need is Secretary Sutters to give us the green light. Imagine us going through 120,000 Massachusetts public school educators and bringing in higher education faculty and staff, because they are currently, some of them are currently working on campuses or in clinical settings. So we're on the cusp of being able to start a vaccination program. We're asking you, our audience, to stay tuned. If we don't get a green light from Secretary Sutters, we need you to express to her the urgency of the issue and partner up with us. So we are taking steps in the right direction, and vaccinating educators as well as pool testing are two factors that when, and I want to emphasize when, as Dr. Walensky says, when combined with ventilation that can control infection, physical distancing, PPE, hand washing, are going to be the things that are going to help us get back to more in-person learning sooner. Regina and Julia, thank you so much for your expertise.